I am Dr. Saibal Moitra. I am a consultant pulmonologist and working in the field of allergy and pulmonology for the past 20 years. Presently, I am the medical director of Allergy and Asthma Treatment Center, now known as NCD Immunomedicare Private Limited, and the consultant pulmonologist and head of Department of Pulmonology at Charnock Hospital, Kolkata. Today we can talk about what are the treatment options we have for the asthma. As we all know that asthma is a chronic disease, though the symptoms come intermittently, but the disease process is chronic. The airways are inflamed, the airways are clogged, there are some changes in the airways, which is a chronic process. So initially, though the symptoms may be intermittent, but if this chronic inflammatory process in the airways, if it allowed to be proceeded, then the symptoms becomes daily. So in case of a chronic disease like your hypertension, like your diabetes, where the medicines has to be taken daily, so it's important that the patient needs to take the medicines daily, no matter whether they're having the symptoms or not. So we have the two groups of medication. One group we call the controller medication, which is needed to be taken daily, and this controller medication is the mainstay treatment of the asthma, and it controls the symptoms and prevents the disease progression. Apart from that, there is another group of medication which are relievers. This reliever medication has to be taken only when the patient gets an asthma attack, so that it can reduce the symptoms and it can bring immediate relief. So the reliever medication does not need to be taken regularly, and the controller medication should not be taken intermittently. This is very important. Now the mainstay treatment is inhalers. We have very good drugs, inhaled corticosteroids, which form the mainstay of the treatment of the asthma. But this inhaled corticosteroids has to be taken through the inhalers. So one has to understand that these corticosteroids are to be taken for a long time. They are in such minuscule amount that they do not cause systemic symptoms. They are pretty safe and can be taken for a long time, and it has to be taken as long as the treating physician or the doctor who is treating the patient tells him or her to take it. These are to be taken by inhaler techniques, so it's important to understand how the inhalation techniques is to be done. There are various types of inhalers available in the market. There are dry powder inhalers, there are metered dose inhalers. But it's important to understand in asthma medication that apart from the importance of the molecule, it is also important to know the device through which it is being taken. So the proper drug taken through a proper device with a proper technique for a proper period, and then only the asthma can be controlled. Now we have very good guidelines which actually dictates that how long the drug has to be taken, when the drug dosage has to be tapered down, what are the symptoms, what are the various factors which decide tapering down of the drugs. So, and that has to be done only after regular follow-up is done with a physician or a chest specialist. There is very common misconception which everybody thinks that inhaler device are the last resort. Maybe the disease has gone to such an extent that the patient has to take some inhalation device. It's totally a myth, because the actual true thing is that this inhalation drugs are the mainstay, and if it started early, it need not be taken for lifelong. There are various graduated scales through which we can reduce or taper down the dose, and at one day the patient will be able to stop the drug if taken under a proper guidance and so with the proper way. So it has to be taken only for the period. So the patient has to be compliant with the treatment, follow the orders of the doctors, and have full faith on the treating physician, and then only the patient can actually conquer and control one's asthma in a very good way. I hope you all found the topics in which I have just dealt with helpful, and it will improve your knowledge base. If you want to know more, you can go to the particular sites, or you can reach me to the CareClues platform.